120/80. That is the number your doctor has been chasing since you were 40. The American Heart Association calls it normal. Textbooks call it optimal. But a growing body of research shows that pushing blood pressure below 130 in adults over 70 may be doing more harm than good. A 2019 study in JAMA Internal Medicine found that seniors whose blood pressure was aggressively lowered below 130 had a 40% higher rate of falls, a higher rate of kidney damage, and no reduction in heart attacks compared to those kept between 130 and 150. The number on the wall chart in your doctor's office was designed for 50-year-olds, not for you. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements, I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. You sit on the exam table in that paper gown. The nurse wraps the cuff around your arm. It squeezes tight. The machine beeps. She glances at the number and writes it down. Your doctor walks in, looks at the chart, and says your blood pressure is a little high. Maybe adds a medication, maybe increases the dose. The whole exchange takes 90 seconds. But nobody explains why the number that was fine last year is suddenly a problem. Nobody asks if you just rushed into the office from the parking lot. Nobody asks if you skipped your morning coffee because you were fasting for blood work. And nobody tells you that the target number itself might not be right for your body anymore. The myth that dominates blood pressure treatment after 70 is simple. Lower is better. Always. That idea made sense when the studies were done on 55-year-olds. High blood pressure at 55 absolutely increases heart attack and stroke risk. But after 70, your arteries have changed. They are stiffer. They are less elastic. And your brain, your kidneys, and your heart have adapted to a certain level of pressure to get enough blood flow. Dropping that pressure too low is like turning down the water pressure in an old house. The upstairs faucet stops working. In your body, the upstairs faucet is your brain. Here is what happens to blood pressure as you age. Your arteries are made of layers of muscle and elastic tissue. In your 30s and 40s, they stretch and contract with every heartbeat like a rubber band. By 70, they have stiffened. Calcium deposits build up in the walls. The elastic fibers wear out. Your heart has to push harder to move blood through these stiffer pipes. That is why blood pressure rises with age in almost everyone. It is not a disease. It is your body adapting to stiffer pipes. The top number, systolic pressure, naturally rises. The bottom number, diastolic, often drops. This creates a wider gap between the two numbers. Doctors call this pulse pressure. A pulse pressure above 60 is very common after 70 and is actually a better predictor of cardiovascular risk than either number alone. But most doctors are still focused on that top number hitting 120. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Donald. Donald was 79 years old, retired mail carrier from Milwaukee, Wisconsin. His doctor had been gradually increasing his blood pressure medications for 3 years. First 1 pill, then 2, then a third was added 6 months ago. His blood pressure was now running 118/62. On paper, that looked perfect. In reality, Donald was getting dizzy every time he stood up from a chair. He had fallen twice in the last 4 months, once in the bathroom, once getting out of bed. He blamed his balance. His wife blamed the carpet. Nobody blamed the blood pressure medication. When Donald mentioned the dizziness to his doctor, The doctor checked his blood pressure while sitting. 118/62. Fine. But he did not check it while standing. If he had, he would have seen it drop to 94/55 when Donald stood up. That is called orthostatic hypotension. The blood pressure drops when you change position. Your brain does not get enough blood for a few seconds. You get dizzy. You lose your balance. You fall. At 79, a fall can mean a broken hip. A broken hip after 70 has a 30% one-year mortality rate. Donald's blood pressure medication was technically keeping his numbers in the perfect range. But it was also the most dangerous thing in his life. Here is your first test. Take your blood pressure while sitting down. Write the numbers. Then stand up and immediately take it again. If the top number drops by more than 20 points, or the bottom number drops by more than 10 points, you have orthostatic hypotension. That means your blood pressure medication may be dosed too aggressively for your body. Do this test 3 mornings in a row. First thing in the morning is when the drops are most dramatic. Bring the numbers to your doctor. Here is your second test. Calculate your pulse pressure. Take your systolic number, the top one, and subtract your diastolic number, the bottom one. If the gap is more than 60, you have elevated pulse pressure. This means your arteries are stiff, and it is a stronger predictor of cardiovascular events after 70 than either number by itself. If your pulse pressure is above 70, talk to your doctor about whether your current medication strategy is addressing the right problem. Things that give you a false high reading at the doctor's office. First, white coat syndrome. Up to 30% of seniors have blood pressure that reads 10 to 30 points higher in the doctor's office than at home. If your doctor is adjusting medication based only on office readings, you may be overtreated. Second, rushing into the appointment. If you walked quickly from the parking lot, climbed stairs, or felt stressed about being late, your reading will be artificially high. Third, a full bladder. A full bladder can raise your systolic pressure by 10 to 15 points. Fourth, arm position. If your arm is hanging at your side or resting on a low armrest during the reading, the number reads higher. Your arm should be supported at heart height. Here is what actually helps manage blood pressure safely after 70. First, home monitoring. Buy a validated upper arm blood pressure monitor for about $40. Take readings at the same time each morning and evening, sitting quietly for 5 minutes first. 2 weeks of home readings give your doctor 28 data points instead of one rushed office reading. Second, potassium. Most Americans get less than half the recommended potassium. A baked potato with skin has 900 milligrams. A banana has 400. Potassium directly counterbalances sodium and helps blood vessels relax. Third, reducing medication gradually, not adding more. If your doctor wants to add a third blood pressure drug, ask whether reducing the dose of the first one might be appropriate. Many seniors are overtreated because doctors add medications without reducing earlier ones. Fourth, beet juice. 250 milliliters of beet juice per day has been shown to reduce systolic blood pressure by 8 to 10 points in multiple studies. The nitrates in beets relax blood vessel walls naturally. This is the Thornton blood pressure protocol. Step 1. Buy a home blood pressure monitor and take readings twice daily for 2 weeks. Record every number. Bring the full log to your next appointment. This data is more valuable than any single office reading. Step 2. Do the standing blood pressure test every morning. If you see drops of 20 or more systolic, tell your doctor immediately. That is a fall risk. Step 3. Ask your doctor one question at your next visit. Is my current blood pressure target appropriate for my age, Or are we using a younger person's guidelines? Donald's doctor agreed to reduce one of his 3 medications after seeing his home readings and the orthostatic drops. Within 2 weeks, Donald's standing blood pressure stabilized at 132/70. He stopped getting dizzy. He has not fallen in 11 months. His sitting blood pressure runs 138/76. On the old chart, that looks high. In practice, it is the number that keeps Donald safe, on his feet, and living independently. Write your age below. And tell me, do you know your blood pressure number from home or only from the doctor's office? I read every comment. Here are your 5 takeaways. 1. The 120/80 target may be too aggressive after 70. 2. Check your blood pressure standing up to test for orthostatic drops. 3. Buy a home monitor and take readings for 2 weeks before any medication change. 4. Calculate your pulse pressure, the gap between top and bottom numbers. 5. Ask your doctor if your target is age appropriate. I made this channel for one reason. The information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this video helps even one person avoid a fall caused by overtreatment, it was worth making. I'll see you in the next one.